Hello, I'm Ashley,
And I'm Danielle.
and we are the Crohn's and Colitis dietitians. So, the number one thing that we hear all the time is that people feel overwhelmed by how conflicting the information is online, especially around things like nutrition. So, we're here to make that a little bit easier.
Yes, we want to lessen the overwhelm and help you feel as good as you can with IBD. And one of the big topics that we're talking about today is about iron and why it's commonly low in IBD. So, Ashley, did you know that 60 to 80% of people with IBD have an iron deficiency?
That's a lot. It really
Yeah.
is. That's a lot. And I think a lot of people wonder, why is that? Is it because we have malabsorption? Is because I think a lot of people go straight to malabsorption as like reason, but there's so many other reasons that can play into why we're all, more susceptible to low iron. Yeah. Not just malabsorption, but it's also, do tend to eat a little bit less, especially if you're in a flare up, and that's can be uncomfortable. Things like having a GI bleed.
Yeah. And of course, one of the core symptoms of IBD, unfortunately, having diarrhea. That is a big one. And then another big one is, of course, increased inflammation when you are in a flare.
Yeah, and this one's kind of interesting because science of this is essentially when you have active inflammation, what happens is your liver secretes more of something called hepcidin. And hepcidin is essentially your iron regulator. So whenever it increases due to inflammation, your iron absorption actually decreases. And so this is one of the main reasons, even if you're not having a GI bleed, if you're in a flare up, this is one of the main reasons that people may see lower iron. It's due to what's happening with regards to inflammation. But then you have these other compounding factors like the decreased food intake, the potential malabsorption, the diarrhea, and if you're menstruating, that's another level of that. If you're pregnant or if you're just not getting enough overall, those are complicated factors that can make it even harder to really get enough iron and to actually absorb it, and your body has to bypass all of these different barriers.
Hmm. Absolutely. So, keeping everything in mind there, some of the common signs of iron deficiency, we're going to list them out for you so you can be mindful if any of these apply to you. And then we're also going to talk about some labs for you to take a look at to ask your doctor for. So, some of the big signs of iron deficiency are fatigue and weakness being some of the more common ones. Pale skin, an increased heart rate, or chest pain can also be a sign of an iron deficiency. Being cold all the time, having poor circulation, having cravings for ice, which is called pica. Dark under eyes, brittle nails, or spoon shaped nails are some of those signs of iron deficiency. So, if any of those stand out to you, please consider asking your doctor to have your labs looked at. So, the labs we want to take a peek at are a few, not just one, but hemoglobin, hematocrit, ferritin, and iron saturation can tell the big story of what your iron levels are looking like. And this is important to talk with your doctor about because unfortunately, not all the time our doctors have the time to address this with us. And that can be for many different reasons. Of course, they're focused on helping you and decreasing your inflammation. I feel like that's always at the forefront of appointments. And sometimes, too, doctors don't pay attention to nutrients. That's kind of what we're here for.
Definitely not as much as us. Yeah.
Right, right. Absolutely. So, having that awareness for yourself can be really helpful in taking control of your iron levels.
Yeah, so you can advocate for yourself a little bit. So if they're not asking for it, this would be a good opportunity to be able to bring this to their attention. So a lot of times people won't run ferritin, but this is an important one. It's more ones that we advocate for as dietitians all the time because we want to see what ferritin is essentially your iron storage, but it tells a story too. So if we were to look at hemoglobin or hematocrit, but not look at ferritin, sometimes your hemoglobin looks fine, but your iron stores might be drastically low. This actually happened to me too. My hemoglobin was fine, but for years my ferritin was just so low, and no one was running it. But then we requested it and saw that it was a 5, which is low enough to cause a lot of fatigue, and it's also considered an anemia, but it's just not as commonly run as the others. So those are some things that you can ask for to really help things stay on track when it comes to your nutrition.
Yes. So then, if you find that you get your labs back and your labs are not within normal range and they're low, we have some action steps for you to consider as well. Oral supplementation is always going to be a big one. Why? Because when you have IBD and your guts aren't working in their best function to absorb iron, that extra boost from supplementation can be super helpful. Unfortunately, sometimes food-based treatments may not always work. It just may not be enough, especially kind of what Ashley said, like when your ferritin is 5. It's just
There's
not
just
going to
not
be.
There's not enough you could take. Yeah, I agree. And also to mention, typically the best iron rich sources are going to be like your most bioavailable stuff is going to be beef, which can be contraindicated in IBD, especially in large amounts, because people are often sensitive to it, often have a gut response and symptoms, but then also it can increase your risk of flare up if you're having quite a bit of it. So we do want to get very specific with that supplementation too, because you don't want to just be taking anything. You will need a specific dose. You may need to troubleshoot it a little bit too, and work with someone. If you're not absorbing it very well, you might need to alter the way that you take it. There's even some research looking at taking it every other day as a way to actually increase absorption. So there's lots of different tips and tricks that you can use if you have someone on your team looking at that for you. Now, I want to ask you, are there any missteps that you feel like people might unknowingly assume is something else, but actually could be iron? I guess what comes to mind for me is when the with hair loss. Hair loss is one of those things that marketing wise, what we see is people go straight to biotin all the time, like biotin or Nutrafol. And sometimes we're not thinking about it could be minerals. So
Mm-hmm.
especially iron, notably your hair gets more brittle, especially if it's really low over time. You might see some hair loss, but we're not often thinking about that iron, and that goes along with having inflammation and stuff and low nutrients overall.
So there is also instances where someone still may not be able to elevate their iron levels with oral supplementation. Your doctor may take a look at trying another supplement, or they may take a look to see if an iron infusion would be something to best suit your needs. Now, Ashley, I've never had an iron infusion. Have you?
Really, I have. I had one, I think when you first came on a couple years ago. I had been on and off anemic for years. And we couldn't really figure out the core why. My personal experience, I did have heavy periods for a period of time. A period of time. I did have heavy periods. I also, had been dealing with on and off gut stuff. Yeah, I did have an iron infusion, and it really did help. It was the one thing that I had been supplementing for a while, and it just wasn't like bringing up the ferritin, and I had done every trick in the book like that we help people with, and so we did end up going with iron infusions, and it made a big difference. The biggest thing that I saw is that my hair finally grew back. Like I had never been able to. My hair is actually long now, but if you go back a couple years, I've always had short hair, and it was always thinning and falling out a lot. And when I finally got my iron up, it actually started growing for the first time. My nails, you could notice they just seemed so much healthier. I wasn't as tired, and I think something with IBD that's kind of when you've had it for a long time, sometimes you get used to a certain level of fatigue that it feels like it's normal, but it's not. You've just been living with it for so long. And so I think for me too, I noticed a lot of improvements with just not feeling as fatigued and having less flutters like in my heart. And I mean, it was a big improvement for me. Less cravings for ice. I had some weird cravings too with my low iron. just weird stuff that would just seem appealing to me. So I was going down that path of like pica.
Did you have the dirt craving?
Dirt or like chlorine. I don't know if chlorine is a common one, but I just had these weird stuff that I was like, I just feel low. Yeah, that's what happened. And it was hugely helpful. I did get a little bit of itchy skin when I did it,
Mm-hmm.
which I don't know. I remember my doctor saying that it wasn't related, but then I also saw a lot of stories online where and heard from other people that have, had the same thing. But ironically, it was on the opposite arm. So I had the infusion, I think, on one side, and it was on the opposite arm. Like the entire arm was just very itchy the day after, or I had to take antihistamines and stuff. It was just maddening. But I don't think that happens to everybody. So
Wow. With that being said, too, would that stop you from getting another iron infusion if you needed it?
no, it wouldn't because of how bad I felt and stuff. Especially I've had before all this, like when I was really in the thick of really bad flares. I've had really scary moments with iron where they've looked at transfusions and stuff. So I've been in those situations, life threatening, where yeah, you need iron. Like take whatever you need to take to overcome the discomfort. But yeah, it can be very serious and important for you to have it.
Mm-hmm. And it just goes to show there's lots of steps that somebody can take to work on their iron and to increase it over time. That's the unfortunate part of it. It does take some time to increase, but there's still a lot of hope to seeing success and feeling like you're no longer this fatigued IBDer anymore.
Yeah, and I think what drove me to finally take action with it was reading about how important iron was for the immune system. I don't think we ever
Mhm.
hear or talk about that enough, but I think I was reading a research paper on the importance of iron and the role that it plays. And I was like, okay, this is important for even just the trajectory of my IBD and making sure I stay healthy, because the fact that iron's transporting oxygen throughout your body, that's so important for everything cognition, being able to think clearly, sleeping, not having restless leg, those are all important aspects.
Yeah, absolutely. And maybe we talk more about all the goodies that iron can do for us in another video.
Yes. Yeah. So stay tuned for our series on iron and other things about what to eat for IBD.